Laura Maloof Miller, Wellness Program Manager for HealthNet. I'm on the line as well as Kristen, and of course, our presenter as well. Thank you again for joining us for the September Wellness webinar. Just a couple of things, as always, you are muted upon entry. That's to avoid any background noise. If you happen to be in a conference room and use like an access for your whole team, if you would kindly chat that number of attendees to Kristen so that we can get an accurate number on attendance. If you wanted to change your audio settings, you simply click on the join audio icon and you can go ahead and do that. All right. There's also a quick anonymous survey at the end of this webinar. We're not exactly sure if we're going to end on time today. We may go over a little bit. So again, this presentation is recorded. So if you need to drop off, no problems there. J-Rod, if you go ahead and go to the next slide. If you need to get a hold of us, please use the chat function. So you'll just hover over the chat icon. This little box is going to pop up and you'll be able to chat Kristen or myself. We will, at the end of the webinar, because it's being recorded, we generally will send that link to the recording along with these slides in just a couple of days. All right, next slide there. Please keep in mind that this information provided in this presentation is intended solely for the general information of the audience. It's not medical advice and shall not replace consultation with your physician or other qualified health provider. If you have any health-related questions or problems, please seek the advice of your physician or other qualified health provider. All right, next slide. We are so pleased to have J-Rod de Los Angeles from John Muir Health. That is one of our medical groups. He is here to present today on the topic of micro workouts. So J-Rod, maybe you could quickly introduce yourself and then we'll start the presentation. Thank you so much for your time today.
Yes, so thank you so much for that introduction. So again, my name is J-Rod de Los Angeles. My background in fitness and health is actually more from the side of physical therapy. So that's what that abbreviation is at the end of my name there. It stands for physical therapist assistant. So my background is more rehab based, and a lot of the exercises I chose for you folks today are things based off just like where a lot of individuals tend to have some weakness for their upper body and their lower body. So I tried to be as efficient as I could, as well as just give other ideas and suggestions on like designing your own workout routine. So we'll jump right into it right here. So just like before, all the information I am giving is just general information. If there is anything specific regarding like any of your joint pains, it's a good idea to just consult with your doctor, just so you can get specific care again, because then everything I'm demonstrating is generalized, although I will have some modifications if some things are difficult for you to perform. So today's agenda, we plan on just kind of learning the benefits of micro workouts, how to basically create a template for a micro workout catered to you, understanding the advantages and disadvantages of said workouts. And then we're just going to review just some body weight and resisted strengthening exercises. They're going to go kind of hand in hand because a lot of the body weight things we could simply add some weight to. And then near the end, I have two specific, I think, resisted exercises to kind of run through here. So let's jump right into it. So when it comes to like your idea of fitness, unfortunately, a lot of us here in the States, we just don't typically move enough, and we don't get the recommended amount of activity throughout the day. So a lot of this graph here is from the CDC, just about, I think it's 2 years old now, 2021 or 2020 or so. But they're just finding a lot of people just aren't regularly active throughout the day, especially as people are transitioning to working from home. I often get complaints that sometimes people who work from home, they almost work longer than they intended to, just because they're constantly on the clock. and as a result, I'm getting kind of injuries with like the neck, the shoulder, and the back. The low back has calmed down a little bit since about 2 years ago now, with the I guess the popularity of standing desks, but it doesn't kind of excuse or it doesn't replace the act of actually changing positions regularly. So hopefully today, after we talk about micro workouts, you'll have a better idea of like what fitness can look like, and it doesn't necessarily have to be like the 30 minutes to an hour you have to put in a class or a gym. So generally, like the benefits of exercise, these are just some common things. Uh, Oftentimes you'll hear this on your primary care doctor's visits. They'll tell you how to manage blood pressure because that seems to be a rising issue here in today's healthcare environment. And also, a lot of it actually has to do with mental well-being as well. So when I was studying as an undergrad for exercise science, we've often kind of considered research or looked over research helping with like symptoms of anxiety, depression, and how exercise can kind of give you that extra boost to feel a little bit better. Of course, for healthy bones, muscle, and joints, just that gentle stress you put on yourself. And we'll talk about how to kind of load the joints and exercise safely. But I think there's a misconception of like exercising too much can kind of wear out some of these things. And that might be the case for said professional athletes. But I think for the general population, it's just a good idea to stay relatively active and fit. Of course, there's a whole bunch of reasons to consider exercise just for your systemic health. And even if you have a family history of some chronic conditions related to your heart, cholesterol. So I'll jump right into the rest here. So when it comes to micro workouts, a lot of people assume, I think, that if you're starting a micro workout, you're just kind of taking it a little bit easier. But there was a study done with a few 20-year-olds who work in healthcare, and they're told to just exercise very lightly. I think that we'll go over the exact parameters of the study, but they're just told to exercise 1 to 2 a week. And those exercises, I think, range from anywhere between 5 minutes to 10 minutes at a time. And the one thing that they wanted them to do is they can kind of vary the exercise. They can keep it a low intensity, they could keep it a moderate or moderate high intensity. But what they did find with these younger people, just exercising 1 to 2 days a week, is that after the study was done, they felt that they were able to cope with stress a little bit better. So when it comes to just gently kind of working out, there are some benefits immediately, even to like somebody who might already be fit and relatively young and healthy. It just cognitively might help you deal with stress a little bit better. So for the parameters of that specific study, like I said, it was 1 to 2 days a week. It could be as high as or at least 10 minutes long. It was stressed that form still counts, even though with shorter workouts. And I think that's an important disclaimer just because a lot of the fitness trends these days tend to be related to, I believe, HIIT. So that high intensity interval training, often considered a very, I guess, efficient workout as well. But sometimes if people don't have the prior fitness level to approach such an activity, sometimes they might hurt themselves. Or again, if the class is rather large and they're taking these sort of exercise workouts, nobody's watching their form. So I can't stress that enough. And hopefully we'll get over, or we'll talk about a little bit about the form as we go through the presentation here. But yeah, so essentially, this is just an image of just some simple body weight workouts. You can see the individual working there with the bottle as his resistance. But primarily, a lot of it, you'll get a good workout with just body weight things, and we'll kind of go over that in a moment. So on the other end of the spectrum, Netflix has recently come out with a series called Live to 100. And so I was watching this recently, and I thought it would be good to add into this presentation just because what a lot of these individuals are is more of the elderly population. And in my field, I see a lot of elderly people who are prone to fall risk and hurting themselves or have a condition called osteopenia, which is kind of brittle bone or the precursor to osteoporosis, which is a very or not exaggerated, but a more severe form of like brittle bone. And so in this documentary, this individual follows a group of elderly people who are aging beautifully. And what I mean by that is they're elderly people who actually stay regularly fit by performing just simple movements every day and doing it every day. So, one of the big examples here in the first episode in Okinawa was a lot of the elderly population don't have much furniture around their home. And so they constantly have to get on and off the floor, and if you consider that for a moment, getting on and off the floor, that's a whole body exercise in itself. And if you can imagine doing that about 30 times a day, like they kind of quoted themselves doing, that's almost like squatting repetitively throughout the day. And as a result, these individuals have great balance. They're very independent. They live alone. They actually manage a garden, which is impressive as well. And they do it out of necessity. But then it's also generally good for their health to continue doing those repetitive motions. And in that case, this is an elderly person performing a squat. And one thing I do want to point out with this sort of exercise is a lot of people tend to be very quad dominant when they perform a squat, meaning they kind of get in that catcher's position or catcher's pose on their toes. And some of that has to do with just hamstring tightness and poor flexibility in the hips and the low back. So if you ever consider a squat, I think the popular term in fitness is a goblet squat. Um, Keeping the heels flat on the ground and seeing if you can maintain your balance in that position. But as you kind of push into that position with more pressure through your heels, you actually get more hip activation, which in turn can really help with your balance, and so you can age gracefully. So, so point of those slides essentially is it doesn't matter what age you are, you will most likely benefit from some sort of workout, whether it is kind of gentle or short term or repetitive and safe. So when it comes to structuring your workout, I always like to do this for my patients. I always consider something for strength, something for flexibility, and something for balance. And ideally, we pick out some workouts that kind of tackle all three just to make things really more efficient for the person. The other thing we tend to do is it's always a good idea to consult with like a personal trainer, maybe in the beginning, just to get an idea of like where you're not very strong. And it could be a personal trainer or physical therapist if you already have some aches and pains, but they can kind of introduce you to just some basic exercises that can kind of be more tailored to you. That's the one thing I do like about physical therapy and personal training is depending on who you're working with, they typically are like a tailor. And so they will tailor workouts specific to you. Workout classes, again, are very generalized, so it's hard to make that specific to some of your goals. So at least with this approach, you can kind of figure out where am I not so flexible? Where could I use some strengthening? And how is my balance during these days? So it's because those are also good things to keep track of, especially balance, which we often don't talk about or consider when it comes to working out. So here are some templates that I've developed for you guys here. And again, I think these slides will be available a little bit later today. But when it comes to a micro workout, it could be as little as 30 seconds a day. Most ideal workouts, I think, when it comes to micro, is anywhere between 5 to 10 minutes. And so I have these kind of guidelines here. So for me at our office, we actually have kind of a fitness challenge going on. And that's kind of one of our ideas of a micro workout. And one of it is actually pull-ups. So every day, all of us at the clinic, we try to do just see how many pull-ups we can do. And for me, my goal is anywhere between 6 to 10, for example. And so that's kind of my micro workout for the day. And that literally takes me about maybe like a minute or two for my lunch. If I wanted to get a second round or set in, just maybe one set as a warm up, I'll go ahead and do it again. But that's actually a good goal. And what that does is, yeah, I might be just doing one set a day or two sets a day. But if you consider that in a 5 day work week, that's about 50 pull-ups in the week versus if I were to kind of maybe incorporate it in a gym setting, I might do about 30 for that week. So if you consider that, it adds up. And it's just making that extra effort and that little time to get something active done throughout the day, or just kind of getting out of my seat and trying something a little different. Another simple goal I like to highlight is planks. So a lot of people often complain about low back pain or how they just don't have a strong core. And while there is I guess, an idea of what a strong core looks like, it doesn't always have to be that six pack. All the good stuff can just be under the fun stuff, as I like to put it. And so, again, taking that time to just develop that core, plank is a great exercise because it doesn't necessarily strain the neck as much as like crunches do for most individuals. And it's a good idea to just have somebody watch your form or watch yourself in the mirror. Oftentimes, people kind of arch their back a little bit while they get into that plank position, or they push their neck forward. So those are two things I do want you to keep an eye on if you were to try those plank exercises. Is I want you to think about keeping the back relatively flat. You can have a light arch in the back because that's typically normal for the spine, and also just try to keep your eyes kind of pinpointed on something on the ground, just so you don't kind of crane your neck over. The other thing I would say about planks too is just pay attention if your shoulder starts to bother you, and maybe that might be an idea to do try some of the modifications, which are oftentimes on your knees to reduce the intensity. Another example for flexibility in this case is stretching. So I find that most people in their kind of 30s to 40s, when they get back into the fitness routine, they kind of ignore flexibility. And that's important because for a muscle to function properly and efficiently, it should be in a generally neutral position. So if you're starting off with a short muscle already, you might hurt yourself or strain yourself. So if flexibility tends to be a problem, or if your range of motion isn't exactly normal, and to kind of get that idea, you would it would be in your best interest to maybe consult with a physical therapist or get a referral for physical therapy, just so you can get ahead of the problem there, and then hopefully get into like a stretching routine. So the column on the right is more of a kind of a traditional, I guess, micro workout. If I were to do all these exercises in one go, which would be kind of considered just a circuit, one circuit or a 5 minute burst, that would probably be like about 5 minutes for me to do, maybe a slightly longer, give or take. Um, and I could kind of change this up a little bit. So a lot of common things you could do when developing your micro workout, you can kind of assign reps and sets, or you could just kind of do intervals for time. So in this case, if you go to the bottom there, if I time each thing to about 30 to 45 seconds, yeah, it would come out to about 4 to 6 minutes. The other thing, if I wanted to extend it out to like a 10-minute workout, I could treat it like a circuit training. So I would go through each activity at least once, take a short break, and then go through the circuit once more time. As much as I'd like, maybe up to maybe 3 circuits or 4. And that could probably be easily about be a 10-minute workout or slightly longer. So you can kind of take a base of what you already know and start to just tack it on top of each other. And again, if it's a little too intense or if you feel a little sore after the first time, tailor the reps. So you can always 10 is just a standard number we typically pick because it's a rough number just for strengthening. But ideally, if you want to work on endurance, like you see a straight leg raise there, I'm doing 15 because it's a relatively low impact, low intensity exercise. And I just want to work on the endurance of those specific muscles. And if you're not familiar with any of these things on here, we'll kind of discuss them near the end. So we're taking that template and we're adjusting it based off your fitness level. So let's say you try that and you're like, oh, okay, that wasn't too hard. That wasn't too bad. I want to see if I can just make it a little bit harder. So for the sake of cat cows and open books, those can be changed just based off your starting positions. So a seated cat cow tends to be just a little bit more gentle, a little bit more comfortable for somebody who might have wrist pain. Quadruped is a little bit more of the weight bearing aspect, so the intensity increases a little bit. Open books, that's an exercise laying down on your back and rotating to the side. Side lying tends to be comfortable, tends to be safe, a nice gentle warm up. Half kneeling, that'll actually lock out your hips a little bit more, and you'll really have to focus on rotation of your mid back. So that's increasing kind of the mechanics, the intensity, and the technicality of the exercise. As we go into like more of the strengthening component of this program, we're seeing that there's variations of how to do some of the resisted work. So push-ups on our knees, that tends to be a little bit more comfortable for somebody who can't handle their body weight too well. And then the hook lying straight leg raises, that tends to be more comfortable for somebody with their low back pain, for example. And seated might just be much more comfortable to handle the resistance when you're working with dumbbells for the Arnold press. Now, the higher intensity exercise, tall kneeling, that's when you get on both knees and you're just kind of kneeling essentially. But that'll engage your core a little bit more. So now that becomes a little bit more challenging. Push ups, those are just standard push ups. But if you did want to raise the intensity, there's all sorts of variations you could do with your hands. A long sit straight leg raise is as if I were sitting on the ground with my legs stretched out. And what that does is it shortens my hip flexor, which we're targeting with that exercise, and it makes the exercise a little bit more harder on the quadricep, which is important for knee health. Now, as we get into the tail end of this program, a lot of these exercises are geared towards core and lower extremities or your legs. And I picked those specifically because with the legs and with the core, those have very strong influences on your balance. So if we go back to my slide about 2 slides ago, where I'm really trying to tailor this program to hit all those things that I want: that strength, that flexibility, that balance. So dead bugs is it we'll go over that near the end of the slide as well if you don't know what those are. And bird dogs, they cater to being either on all fours or on your back. And depending on how good your balance is, we will tailor it to just that. A Romanian deadlift tends to be something most people get scared of because of how intense it could be on your back. But I think if we just practice that hip hinge motion, which again we'll talk about near the end, that'll be important for you to isolate your hips better when it comes to doing functional activities like carrying your groceries and just generally lifting in the gym with good form. And then squats are always just a good exercise to do just to maintain your general health. Split squats are kind of a reverse lunge, and we'll go over that again at the end. So just some general ideas of how to just make the intensity a little harder. It doesn't always have to be increased resistance or increased weights. Some of it could just be changing your position and changing your starting position as well. So here are just another example of modifications we've done with the workout. So if we are just kind of gently getting into exercise, I always recommend calisthenics, which is just primarily using your body weight rather than any resistance. So if you do the workout, you'll be surprised of how much of a good heart rate you get from doing some of these exercises. But of course, if you want to raise the intensity, if your fitness level is already kind of high, you can start adding some of those dumbbells into the equation. So these are just some general recommendations for somebody starting some of these newer exercises. Oftentimes you'll see some modifications here. So instead of a push-up, we have a chest press. I usually recommend people start off with dumbbells at first if they're new to exercises, because that'll keep the shoulder a little bit safer as you start and begin your exercise workout and routine. And if you have kettlebells available, those are also great because of the kind of the awkward distribution of the weight. There's been a trend of like something called functional fitness, and it's kind of dealing with weights that typically can sometimes not be so symmetrical and not so normal because life typically doesn't feel that way. So it's important to kind of work with loads that kind of challenge you in that way. And then bird dog with a row. If any of you are familiar with dumbbell rows, it's just kind of adding a row when you kind of straighten out both legs. And I'll kind of give you that visual here near the end of the presentation. Other things you can try to do to kind of make your exercises a little bit more well-rounded. And I didn't really add aerobic exercise at first because a lot of the recommendations tend to be, I think, 30 minutes or so for good quality aerobic exercise. So if it were up to me, I would recommend kind of adhering to some of those CDC guidelines when it comes to like walking and jogging. But if you did want to just add some aerobic exercise to your workouts, these are some really great examples. I often love to use whenever I'm have a patient, if we are kind of trying to get them back into more of an athletic goal. Jumping rope is a great exercise. Mountain climbers tend to be really good. And boxing drills, surprisingly, are very exhausting. And of course, as everybody remembers from their PE days, burpees can also be very challenging as well. But those tend to be a little harder on people's joints. So again, depending on what your goals are and maybe what sports recreationally you like to do, that might be something to consider. More safer things for people, I often find rowing machines tend to be comfortable for most people, as well as swimming. And if we want to just take it very gentle, again, we can kind of consider those micro goals of 30 seconds or about 5 to 10 minutes of walking during your lunch, just for some aerobic activity. That could be the start into your fitness routine there. So, what are some of the advantages of these micro workouts? Well, number one, they're time saving. So, me as a new father, I'm having trouble kind of incorporating a good exercise routine compared to when before my daughter was born. So, oftentimes I am struggling to try to get my workout in throughout the day. And now I'm starting to do these 5 to 10 minute workouts just for myself as I try to get back into shape here. Um, the other thing that's great about most micro workouts is there's a lot of like resources out there and a lot of apps and like YouTube and even Netflix has a whole series on working out. Nike has a whole series about fitness exercises, and most people do have Netflix. And so those can also give you some ideas about how to use your space and just general equipment you might have around the house. And while it is money saving, in the long run, I do recommend that maybe consulting with either a personal trainer or a physical therapist if you're not too familiar with exercise or aren't sure if you're doing things safely. If even if you do have like prior injuries, it would be a good idea to consult with these individuals. And again, just to really tailor a program that would be best for you. There's always ways to make exercises harder. So like if they do give you a base to work off of, you can even try to do research of progressions yourself. And the other thing with these shorter exercise routines and intervals, you tend to not get so beat up or sore afterwards where you need a couple days to recover. So it's just some great things to do just to stay active again or just begin to get active again. Some disadvantages of micro workouts, I will say that I don't necessarily believe the bottom one, although they are sometimes done solo. I think with technology these days, you can really get more people involved. So, in the sake of my office, for example, we like to do challenges together. So we it tends to be more of a social thing, and we keep each other honest. The other thing you could do, and we used to do this with our Apple Watches, we used to coordinate with each other and send challenges to each other, just so we can keep each other on pace. Especially when I was younger, when we were training for races, we would often use social media to kind of keep each other and motivate each other towards our goals there. Um, the other thing too is if you are working out by yourself, it's very easy to hurt yourself with some exercises, and that's why it's always a good idea to refer to somebody or have an extra set of eyes just to make sure you're doing things properly and safely. And of course, it's just there's a little bit of a transition as you try to understand changes of what fitness looks like exactly. So, it's very easy to compare yourself to these like fitness professionals on social media, but just know that everyone's fitness journey is a little bit different, and you don't always have to adhere to what's considered fit and beautiful and whatnot. So, there's going to be some changes if you do begin micro workouts because you might say, oh, so and so did an hour or at the gym or 30 minutes. I wish I could do that. But no, it's everybody's journey is a little bit different, and everyone's progress is unique. So consider that. So here are some examples of some of my favorite exercises. So this is a nice resisted exercise that generally is good for the shoulder and the neck. If you remember our former governor, Arnold Schwarzenegger, he popularized this exercise, of course, where it kind of combines a shoulder press with just a slight rotation of the shoulder. So, what I often like to do with this exercise in a rehab setting, just to kind of make sure the shoulder is stable, because it is so mobile, I often have people stop at about 90 degrees, um, I guess, from the side. So, if you look at this individual, the bottom when he has the weights, he has his elbows all the way tucked in. Sometimes I'll have people have their arms up almost like a boxer, and they would maintain that shoulder press movement throughout with that boxer position. And that really does teach like shoulder stability. Of course, most people are surprised at how hard this is even without weight. So if you are new to exercises, I would recommend trying this with no weight and seeing if you can get to 10 comfortably. If you can, then maybe you can gradually introduce weight from 5 pounds. And if you are already fit, you'll find a good challenge with anything 15 and above typically. Again, focus on slow and controlled mechanics. The shoulder is very mobile, so you want to emphasize stability as much as you do with power. And again, we talked about modifications that you could perform either in a tall kneeling position or even a seated position for safe, or you can even do standing, and that typically is more comfortable for people. So push-ups, we've talked about push-ups briefly, but here are some examples of modifications. So for example, you could try the traditional push-up. If you notice this person's elbows are slightly tucked in as they come down, and I think that's important to note with this particular exercises. Oftentimes I see people who do a push-up, their shoulders and elbows tend to kind of wing out and they tend to be a little bit wider than they're supposed to. And as a result, sometimes you could strain your shoulder. So if you modify it with kind of your elbows tucked in, sometimes that's called a gymnast push-up. It tends to be a little bit safer on your shoulder joint. It does target a little bit more of your triceps, but you definitely still get that chest workout. And for individuals who do struggle with wrist pain, you can always kind of make a fist as you come down, or you could, or make a fist as you start the exercise. That way your wrist is a lot more stable and neutral. And of course, if the push-up is already just hard to do, you can perform it on your knees, and that reduces some of the resistance and strain you put on yourself. So a straight leg raise exercise, this might be more habitual from my rehab background, but I often find people have very tight hip flexors, which is the diagram you see there at the bottom. So that's actually your main hip flexor. It's called your iliopsoas. And I like to just keep in mind, or like let people know, is how big and how long that muscle is and how it relates to your low back. So if you briefly look at that, most people do have tight hip flexors, especially if they are in kind of an office job or office setting. And so I often want people to get these muscles a little bit more mobile and a little bit stronger. So if you look at the diagram to the bottom right, you'll see that the right iliopsoas is slightly tight, and it's actually pulling and kinking the low back a little bit. And so most people, granted, they might have both tight hip flexors, but oftentimes you find some asymmetry in the way we kind of live our lives, and our muscles will reflect that as well. So it's a good idea to kind of address this muscle group. So when we do something called a straight leg raise, you do target your quadricep, which is the main muscle to straighten your knee, and you target that hip flexor. And so we briefly talked about these modifications. So the image on the top there with the person laying down, that's called the hook lying position because their body kind of makes a little hook there. It's a little generally more safer on the back and tends to be like lower intensity. But if you really do want to challenge yourself, you could do it like the woman at the bottom there. And she's just kind of raising her leg from that long sit position now. And that kind of challenges the hip flexor because now it's working from a shortened position, still relatively safe on the back. And that quadricep actually works on overdrive in this position. So people with knee pain sometimes may benefit from this exercise. So going back to kind of the split squat. So the difference between a reverse lunge and a split squat is just the starting position. So in this picture, this individual is more performing a reverse lunge. So they're starting from a regular standing position and they're stepping backwards as they kind of do that kneeling pose or position there. Now, a split squat, typically that individual will be in that kneeling position already, and they will just gradually go up and down from there. So in this case, you can definitely use your body weight. Most people actually, if they do have kind of a weak hip or a weak core, they find their upper body and their hips swaying a little bit as they do this exercise. So one thing I do want to stress that's not really in the directions here is to kind of brace your abdominals and keep your hips relatively forward. Now, the other thing about this exercise is most people will actually perform a forward lunge while doing this exercise. And as a result, they end up kind of straining their knee a little bit or hurting their knee. And so if we go to the next slide, we kind of look at the mechanics of how to do this exercise a little bit more safely. So the image on the left reveals just how to perform the reverse lunge. You could see that his knee is relatively above his ankle, or his front leg, that is, that right or that left front leg is typically more on top of his ankle, and that reduces the strain he puts on his knee. Most of the pressure does have to come at the heel, so you can get that activation through that hamstring and that hip. And I often see people try to touch their knee to the ground, which is not necessary. You kind of just hover right above there, and that tends to be a little bit safer for both knees. So if we go to the image to the right, that individual is performing more of a forward lunge. You can see that the angle is a little bit more dramatic, and the knee kind of gets away from the ankle and gets closer to the toe box, and that kind of it does work out the quadricep a little bit more, but again, it does strain that knee and that kneecap a little bit more. The back knee, it's not too treacherous there, but it's more that front knee that I'm worried about for this individual. So consider it to do more of a reverse lunge format. That way it keeps the kneecap a little bit safer. So squats, typical easy exercise to do without any weight. You can add weight again to make it a little bit more challenging. But for the squat, like we saw in the slide discussing the Netflix special, typically I do want more activation through your hips and through your hamstrings a little bit more. So kind of shifting your weight a little bit closer into the heels if that feels a little uncomfortable for you or a little bit unnatural. Maybe having a chair nearby just as for safety reasons. But consider trying to do your squat like this and you'll notice a slight change in your mechanics. Your knees might feel a little bit better, but as you get lower, keep in mind that the knee does have to shift forward a little bit more. And that's okay. Oftentimes you'll find people with the stress that I don't want you to see your knees go past your toes. And while that's true to an extent, you do have to get that knee over the toes at some point as you get into a much deeper squat. So, but the point here I want to raise when you do perform a squat, just consider initially beginning with your knees behind your toes just so you don't kind of overuse your knees and wear out that meniscus. So in this image here, we have more of what I consider a proper squat. So you can see how a toddler does it best. And you can make the argument that they are much more flexible than we are at this point. But you can just see the weight on this little baby's heels is a little bit more. Their low back is kind of angled, but the back is straight because where they're hinging from is primarily the hips. And so what you're seeing there is that this baby is using a lot of their kind of hip muscles and their hamstrings to kind of perform a proper squat. So this exercise is often kind of nervous for most people with low back pain because it's easy to just kind of reach down towards your toes. And so if we kind of read through these directions specifically, what I'm primarily asking you to do is kind of keep the hands close to the bodies as it kind of floats over your knees. And if it's a little bit taxing either on your back or on your legs to perform this exercise, um, you don't have to go as low. And so I often will find that a lot of people have very tight hamstrings, which restrict them from doing this exercise properly. And so it's just much more safer to start off slow and gentle if you need to. Again, if you are kind of a relatively fit person or kind of really advanced, you could try this with dumbbells, or you could just go for the high rep count till you get that burn kind of in the back of your legs and in your butt, because that's typically where I want most people feel this exercise. If they feel a little bit too much in their low back, you might be going a little too deep, or you might have your arms getting farther away from you. The point is to hinge from your hips rather than kind of your back. So think about pushing your butt back as you try to draw your arms down in front of your knees. And then as you come up, think about almost performing a pelvic thrust towards your hands as you come up. And that'll get more glute activation rather than you kind of bringing your chest up with your low back. And it's really critical to get the mechanics down first before you begin using some resistance, because it's very easy to strain your low back from this position. So this is a more advanced version of that Romanian deadlift. This really does begin to target more of those hamstrings and those hip hinge mechanics. And so oftentimes people with a history of like ankle pain or low back pain, they have a lot of difficulty with this exercise. And so the way I prefer to do this exercise for somebody who is relatively fit is they would actually hold a dumbbell on their opposite um, standing leg. So, for example, in this picture, she's doing it perfectly. If you can imagine her holding a dumbbell or a kettlebell, that makes the exercise much more harder because it's almost encouraging her body to twist. But as long as the core is engaged, that will not happen. So, for people who are starting this exercise and want to do it correctly, keep in mind it's the same mechanics as the regular deadlift. You don't want to necessarily reach down towards the ground. You want your hips to kind of gently guide you towards the ground. And again, keeping that weight close to your leg so you don't kind of strain your low back to try to maintain that resistance. Mechanically, it's more or less the same, just on one leg. You still want to come with do a pelvic thrust to get your hips forward rather than lifting your chest up, which would be more back related. So, a much more advanced exercises. I don't recommend this to somebody who is new to exercising. I actually recommend the first version with both legs down. But if you are close to doing this correctly and you do want to try this exercise because you do find it challenging, the next slide will show some modifications for you. And in this case, you can see two modifications that I really like. So you would do these modifications, one, if your balance is not very good, for sure. And you can see in the image on the left, the individual is holding the wall to help steady themselves a little bit more. You could use something like a countertop or a chair to also give you kind of that control and leverage, so just so you can get the mechanics down safely. You can also see there is a slight bend in both of their knees there, and that's just to kind of reduce the strain that they put on their hamstrings. And that's okay. The knees don't necessarily have to be locked as they kind of get into these positions here. The other modification you'll see is the dumbbell is on the same side for the individual on the left, and that makes the balancing a little bit more easier because there's no risk of twisting as much as the resistance being on the opposite hand. Now, let's say if your balance is pretty good and you do want to try not holding on to anything, I find most people are successful if they try to use two dumbbells. That way they feel symmetrical as they try to bring themselves down. But mechanically, again, it's the same. As you kind of hinge yourself down, keep the weight close to your leg, close to your body. And as you come up, bring your hips forward by kind of almost doing that pelvic thrust or squeezing the glutes as you come up, rather than just raising your chest, because that'll be more back related. So this exercise is also one of our favorites. It's called a die or dead bug or dying bug, depending on who you ask. If anybody has a yoga background, it's based off of that. But with this exercise, it tends to be a little bit safer on the spine. It teaches you how to coordinate yourself as you brace your abdominals, which is very important for somebody who's returning to more active or athletic goals or just generally has an athletic lifestyle. And so you can see with this individual, actually it is difficult to see, but as he braces his core, as he extends his arm and his leg out, or I guess to the sides there, you basically don't want to feel your back arch. And typically you might feel the back arch if, again, your legs are somewhat tight, or if your shoulder is a little bit tight as well. You'll begin to arch at the low back. So just kind of keeping the abdominal slightly braced. And the best way I can kind of give you that cue is to almost just draw your belly button towards the ground. And if you imagine like a hamster or a small animal underneath the curve of your back, try not to squish that animal. You just want to keep some slight tension there, but you don't necessarily have to keep your back super flat against the ground. That's, I think, one common mistake you'll see with this exercise. The back has a natural curvature to it, so it's important you maintain that while you perform this exercise. Now, for somebody who is more fit, we can advance to something called a bird dog. So again, there's more weight bearing involved with this exercise. One thing I want you to consider to stay safe is just keeping the arms and hands right below the shoulder. So in most cases, if the hands and the shoulder, or if the hands and the elbows are slightly above the shoulder there, you end up straining the neck a little bit more during this exercise. So it's good to just be in a good stable position. You could see with her legs that everything from her hips is about 90 degrees, as well as her knees. And that just is a stronger foundation as you perform this exercise. And then as you begin to raise your leg and your arm up, rather than lifting up towards the sky, I want you to kind of consider kind of kicking towards the heel and then reaching out in front of you like you have a question. for the arm, and that will kind of get you to lengthen rather than kind of strain the low back. Now, if you do want to challenge yourself, you can begin to lift a little bit higher up, but you can probably feel this exercise within 10 reps or so that it's already challenging enough to just kind of straighten your whole body out. Again, by kicking through the heel and then reaching through the hand like you have a question. That's one of my best tips for this particular exercise here. Now, when it comes to resisted exercises, I did mention kind of using dumbbells. And if you are performing a chest press, it might be a good idea just to perform on the ground, because that just keeps the shoulder a little bit more stable, a little bit more comfortable for most people. And you can kind of tailor the weight based off your activity level and your fitness level as is. But a nice straightforward exercise that's easy to do from the comfort of your home. No special bench required, just doing it on the ground on a mat should be totally fine. And then just another idea for using resistance bands for you. We have a terminal knee extension. Again, this is more rehab-based exercise, but I have a lot of patients who are returning to martial arts, and some of them have knee pain or hip pain. This has been kind of really critical in keeping their knee a little bit more stable as they return to those particular sports. So it does translate well into higher levels of fitness. So in this case, the image on the left, the individual is using a very low level resistance. So in the case of somebody who is more athletically fit, I would recommend the band kind of on the bottom right picture there, where it does show that that band is typically anywhere about 25 pounds of force to about 50 pounds of force, which is like attaching a cable to the knee as you begin to straighten it. And this way, it's easier to do at home. You don't necessarily need that knee extension machine that you see at the gym. You could just kind of wrap that band around the dining table or your desk, for example, and that should be stable enough to kind of challenge the knee. And this would be more of a high rep exercise. So you would do it till you get a good burn, which is anywhere between 15 to 20. Really focus on kind of holding at the very end as you straighten your knee before you begin to bend again. So hopefully you guys learned something here today. I just want to stress that with micro workouts, they can help anybody at any age, whether you are still young or you're kind of near the or kind of in the older years of life. Some movement is definitely better than none, as the research suggests. So don't be afraid of exercising too much. Just know your limits and cater, and reach out for help if you need to, either through physical therapy, your primary care physician, or a personal trainer. Those individuals are highly trained in exercises, and it's a good idea to take advantage of that. And that your exercise can be as short as you want it and as long as you want it. So micro workout, it's highly variable. It's anywhere between 30 to 20 seconds or 30 seconds to 20 minutes. And you can cater to it based off your fitness level already. So there's a lot of resources out there to try to make it challenging enough for you so you get the most efficient workout as you can. And again, I hope you guys did learn like some new exercises you may have never heard of, or at least different ways of approaching ones that you've heard of before. So I'll go ahead and screen through the chats. I see that there's a lot of questions here, so I'm just going to briefly look over some of them and see if I can answer them right away. So I'm just going to start at the top here.
Yeah, while you do that, J-Rod, can you advance the slides? I'm just gonna,
Sure.
yeah, great. Just as a reminder, we have all of our wellness information for our members on our website. So don't forget to check out all of the information. Go ahead for the next slide, please.
Sure.
Of course, we have health coaches, and if you'd like some support with starting some of your health goals, it's great to work with a health coach. They may be able to help you with some of the information that J-Rod covered today. And for our members who have, you know, an urgent question in the middle of the night, we've got a nurse advice line for that as well. Next slide. And of course, we offer discounts for our members. Weight Watchers is actually offering for next month. If you sign up with Weight Watchers before October 31st, they are offering a free smart scale that syncs with the Weight Watchers app. and our members receive a 50% discount on some of the selected plans. But if you're looking for a chiropractor or need some extra pair of eyeglasses, we offer that as well, and the hearing aid information, as well as our fitness club discount. So members, don't forget to check that out. Next. All right, our My Strength program is our mind, body, and spirit program. Lots of great modules. This is a self-help program, but it also can be used in conjunction with a mental health professional as well. And we have that open to both HealthNet and non-HealthNet members. Next slide. Health challenges. We always have some new health challenges coming up each month. For the month of October, which is open to everybody, is Sweet Dreams. That is going to be about our sleep challenge. It's a 30-day sleep challenge, making sure that you get good 7 hours of quality sleep, as the rapid eye movement or REM sleep is when we dream. They are also offering Less is More. That is a stress challenge to simplify your life and ease your stress. Again, 30 days in October. Eat from the Rainbow. That is a nutrition challenge. As we know, vegetables and fruits come in all different kinds of bright colors. So during the month of October, challenge yourself to add more colors to your diet. And the step challenge is called Spooky Strides. So you know how fall is a nice cool weather for getting out. And so you want to make sure that you get some of your steps in, looking to do 3,100 steps a day in the month of October. As you're walking around, maybe you'll see some Halloween decorations in your neighborhood as well. And then for HealthNet members, we have the October challenge of Snooze Soundly. So again, sleep challenge for that. All right, next slide.
Nope.
Okay, coming up in October, our wellness webinar is Take Charge of Your Health. We know how important it is to put our personal well-being first. You do need to be a little bit proactive, so that does take a little time, but you know, the rewards are priceless. We're going to be covering healthy living, creating healthy routines, preventive care, self-care, and some well-being programs that can help you on your health journey. So we thank you again for joining us today, and hope to see you again next month. And you are welcome to exit the webinar at this time.